It's Our Time podcast is brought to you by Tech for Nonprofits Resource Hub, where we create content for our target groups, that is nonprofits, techies, and ecosystem enablers. TFN is a SaaS digital platform where we aim to connect nonprofit organizations with tech tools, solutions, talent, and emerging issues, and techies to social impact work.
Hello and welcome to It's Our Time podcast by TFN. This is an amazing space where we are showcasing change makers in our society. Today we're going to be having a very interesting conversation, and we're looking at what happens when there are drastic funding cuts, especially for nonprofits. What happens to the employees? What happens to the beneficiaries? My name is Böll, and today I'm being joined by George Ochieng from the Slum Child Foundation, and we want to know more about how they've been able to pivot from this situation. Hi, George.
Hi.
Welcome to our podcast.
Thank you.
It's so nice to see you.
I'm also happy to be here.
I happen to know that you grew up in Korogosho.
Yes.
And Slum Child Foundation is actually found in Korogosho.
Yes.
Would you say that that's what is the vision and mission behind what you do, your upbringing?
First of all, thank you for having me here. Secondly, I was born and brought up in Korogosho, which really gave birth to the Slum Child Foundation. Actually, the Slum Child Foundation, the way we look at it, or the vision that I had, was to create that better foundation for that child who has been born and brought up in the slum setup.
I like that. Just looking at the reason why you've gone back to your community and you're really being rooted in ensuring that, you're bringing up the next generation. For me, I just want to understand what programs you have. What are some of those programs that you have, and how you impacting the community?
When I was growing up, the issues of drug and substance abuse was an in thing in the slums, which was cross-cutting with crime, prostitution, and the likes. So when I went back to start an initiative, that became a niche for me, and I looked at it as, if I'm able to solve this, I'll be able to address a number of issues. So through that, we have a children program. We meet every Saturday from 2 to 4, and we promote life skills to this upcoming generation so that they can make an informed decision about their life now and in the future. We also have a school outreach program whereby we meet with the kids during school time and in different schools, so that we don't want to leave anyone behind. Empower them with the same information, skills, so that they are able to better their performance and get out of the slums. We have a program for young mothers. The young mothers that we are working with are those who have been born and brought up in the slums. They ended up being married before the age of 18, and then, or they became pregnant and the boys vanished through the thin air, and they're left with the burden of bringing up their children. So we try to keep them from the prostitution and all these other social evil practices by ensuring that we provide them with the skills, but these skills should translate into something that will be able to generate an income to them. So it's sort of like an empowerment. Then we do a bit of lobby and advocacy. We do it from the grassroots level, country level, regional level, and international level.
That's amazing.
Yes.
And it's also good to know that what the programs that you're doing here are also having some ripple effects within and without our borders, right?
Yes.
Which other countries are you currently, do you have partnerships outside? Are you currently having programs outside of Kenya? And what does that look like, especially in the global landscape?
Yeah, our work has gained both national and international recognition, because a lot of people want to emulate what we are doing, and they keep on calling us. Why don't you come and help us set up this? Why don't you come and help us do this? So we have a number of people who are interested in our work in Uganda, in Tanzania, a little bit in Burundi, Malawi, Zambia, a little bit of West Africa. I think we have some footings in Nigeria. And across countries, there are others who are interested in our work in India too. So we are slowly getting into these other spaces where people are interested in our work, and they would really want us to help them practice the good things that we are doing within the small settlements of Korogocho.
That's beautiful, just because it's a homegrown solution. And I believe that buy-in is better when it comes from you. And so even you moving from, Kenya and having to expand wide is very commendable. Doing all these programs requires money.
Yes.
And as a non-profit, and also having a background in non-profits, is that you really have to have a diverse source of funding. Today we are talking about what happened when USAID funding was cut. Can you take us through what that looked like for your organization? Were you a beneficiary, and what were the immediate effects? And then we can come into, what happened then thereafter.
I think I forgot to mention something way behind there. I think because it's a program that we closed, but we were working with drug addicts who were on HIV treatment within the slums of Korogocho. So the project that was getting funding from USAID was the one that was dealing with drug addicts, and our focus was to minimize the alcohol intake, which is harmful because it's not this branded big brand of alcohol that you get them in the supermarket, or where it is illicit. We minimize that and encourage them to take ARVs. So when we were doing that, we started as a small initiative within the slums of Korogocho, and we started with a small number of, I think, around 30 patients. And with the time, they kept on inviting their members, those who are also getting this treatment, would offer psychosocial support, would offer household strengthening support, whereby we would provide them with something to eat. And we went even further to think of how can we encourage them to stop using that money to buy alcohol and save that money that can help them either start some small business or empower themselves. So we received our funding from USAID year one, which was last year, to complement other programs that are in the line of ARV provision, and to this special group of people. And then, boom, all of a sudden, changes took place at the headquarters, and we were told it is going to be cut. So, first of all, I think the moment I heard of that, I was very much worried, not as George or as an organization. I was worried about the people who are getting this support from us. These are people who cannot sustain themselves, cannot survive without this medication. But it's not only about medication, it's also about the other services that accompanying the medication. So it came to me as a shocker, because I was like, how will these people survive? Then in terms of work, I was also worried about my staff, because we had to reduce the number. And then there are many people who are directly or indirectly involved in this. And I think at some point, the Nation newspaper reported that we had over 40,000 direct beneficiaries who are employed by USAID, and they had to. So I'm trying to imagine a population of 40,000, and there are others who are benefiting from these other individuals. So it was not an easy thing, first of all. Two, it came to us as a shocker. We didn't see it coming. And the impact has been big, because the number of people that were enrolled in our program, by the time this announcement was being made, we had over 100 people who are directly benefiting from us. And then after, I think, 2 months or so, we lost close to 40 who died, because they could not sustain themselves with the medication, they could not sustain themselves with drugs, because drugs, ARVs and illicit drugs, one cannot go hand in hand. So it was a big, big problem. We would even request some people who are offering counseling services to these people. They are willing to come, but you have to facilitate them from point A to point B so that they're able to come and offer that moral support as a pro bono. And then when we thought we were the only one affected, other institutions that were also getting support from USAID closed down, and now their beneficiaries became our beneficiaries. The other organization would they packed and they left. For me, Korogocho is hometown. And that is the headquarters. I can't pack and leave. Where do I go if I leave? And a number of cries came on. Some of them, I remember there was a woman who came to me and told me, George, everyone is gone. You are the only hope remaining. And if you pack and go, I think we will die. Our boys will start engaging in social evil activities, the prostitution, the crime, and all these other things. So the hit was big, not only to us or not only to me as an individual, but even to the wider community. I am not so sure how long that gap will take to be filled in, but it is big in terms of education, employment, economic-wise, and so on and so forth. So
those are some of the effects, and thank you for even elaborating in terms of the effects to the individuals. For me, I just want to also take us back to how then have you navigated this season, because you can't just stop your programs. As you said, Korogosho is home. You're not going anywhere. So have you been able to just kind of like reshape or rethink your programs? Has it changed your strategy in terms of how the programs you're going to roll out or how you are going to reach out to the communities? And for those who have been adversely affected to the point where we are losing people, what then is the organization doing to kind of just mitigate some of these very adverse effects?
In terms of addressing this, I had to sit down with my team and I told them that this is the reality on the ground. So it means with what we have to minimize and use it well. Where resources are not required, where it is not a must, we don't need to use it. In terms of salary cuts, we had to cut it. I mean, there were others who were okay with what was there because they don't have an option of getting employment anywhere else. Not that employments are not that they're not qualified. They're qualified, but there are no employment opportunities around. So we had to cut. The others who decided they would stay back, the others who decided they would want to venture in other businesses. And I think to some people it was a silver lining. What do I mean by this? They had to think, I mean, I don't need to be in the NGO world. I need to invest into business. And I've seen a number who left us and now they're doing business and it is taking them in the right direction. In terms of
the beneficiaries,
yes,
the beneficiaries of your program, because then we've had adverse effects. And I'm sure this is the case, not just for you, but other non-profits in Kenya and outside of Kenya. What measures can you put in place within that so that whatever funding you have can still be able to sustain them?
Okay, so what we've decided to do is come up with an income generating activity that is able to run some basic programs that can able to sustain us for some time. We had a well-wisher who came through for us and bought for us a public address system that at times we can hire out and generate some income that can help run a few things. Although in terms of income, it is like between 5 to 10%. It doesn't generate much. But again, to the beneficiary, we had a sit down with them and we told them the reality that is on the ground. And we were very practical. If your employment comes to an end, what does it mean? You have to cut some costing and use money where it is necessary. So to them, we've tried to encourage them. If there are other sources that you would put in place, well and good. If you can think outside the box to find a way that you can generate an income, well and good. So some have bought into the whole idea. Others were at the age of, they are broken to an extent that they cannot be repaired. to pick up their pieces and follow the same suit. So those are the categories of people who lost it along the way.
That's very interesting. And I like your point of bringing up in terms of revenue generation and income generating activities, because then you can't really overly rely on one source of funding. And I'm sure you have diverse sources of funding. When it comes to now the reaction and how you've been able to pivot, what would you want organizations, donor organizations, and other well-wishers to know about how this affects strategy when some of these cuts happen drastically? If you are to meet, some of these big funders and have them in a room, what would you want them to know about what the funding does and how this affects the programs and your long-term strategy?
I think coming up with an intervention that is able to make an organization become self-reliant, not only in terms of the structure of the organization, but also to the individuals. If you are able to provide skills, I've seen a number of international organizations giving you, if you are in the humanitarian field, they give you the business skills as an alternate. That really helped. Thinking outside the box in terms of what else can I do. I've seen a number of, I don't want to mention them here, but I've seen a number of organizations investing into the construction industry, whereby they make their own houses that helps their staffs so that you minimize the cost. Whatever they're going to pay you is a little bit. I have seen others do some sort of low-cost housing for their beneficiaries so that whatever they give is very minimal. So the donor world, what we need to tell them is if they can empower organizations. I know in terms of funding, they might be okay. If they're okay to provide the necessary resources to enable the organization move from point A to point B, when they leave at point B, the organization can move from B to C. That is super, super good. But if they don't have enough resources to help them move from those points, give them the skills so that by the time they are done or they're leaving, the organization can keep on running.
Absolutely. Yeah. And as a founder and CEO of this organization, yes, and Slum Child Foundation, everyone is looking at you. So yes, USAID cuts have happened, but everyone is looking at you. And just at a personal level, and there are many founders out here who are trying to do what you're doing. They want to impact their communities positively. What lessons are you learning from since this announcement happened? How is this shaping how you're looking at the future?
One of the lessons that I've learned is being creative and looking at what you have around you and how you can commercialize it in a way that it can help generate an income to sustain the organization. I forgot to mention that we have a radio station as an organization. But after we heard of this, we had to look at what can we commercialize and what can we sustain. So we have worked in a way that the radio station in itself is being commercialized, and the kind of revenue that will be coming from that will help sustain a number of programs and a number of people. So if this didn't happen, I would have not thought of how do I do this. And then out of that, we are trying to think, how do we become creative to look at other sources that can come on board. We've been forced to do a lot of proposal, although at times they don't go through. We've been forced to approach corporates, of which in Kenya business is not doing good, so they're also complaining. But I've learned that you need to be creative. You don't need to panic. It's about being passionate about what you do. Don't give up, because if you give up and you've been building a wall, you are almost at the lintel, and then all of a sudden you are, all the years, for example, like us, the 18 years that we've been in existence will go into waste. So we have to ensure that we become creative. With a little energy that is left, we use it. Try to plug in people, listen to the people. If you look at my team, I'm not a boardroom CEO or boss. I listen to the people. I go to the ground. Whenever my staff go to the field, I go with them. Then we interact with these people. What do you think? This is the scenario. This is the reality. And how do we move? And then the other thing that I think to these founders or people who are running these initiatives around the world, it is always good to be transparent and honest, both with your donor and the beneficiaries. Because if you don't tell them the reality, they will keep on blaming you. Why didn't you? Why didn't you? But if you tell the donor and tell them the reality that is on the ground, that this is a transparent glass, it is not a white glass, they will be able to buy in. And you tell them the practicalities of how to implement that, it becomes easier.
Absolutely. And I like that you've brought in this perspective of now just using what you have and thinking outside the box, right? I'm looking at partnerships. Where do they come in? Because you can't do this work alone. Who are you partnering with within your space? Because now with the cuts, we've seen that this is something that's happening across the board in terms of a lot of donors are really reducing the amount of monies they used to send towards projects, and they're also prioritizing others more than the rest. With the current situation in the world, there are a lot of wars, there's famine, etc. So they're looking at education would not take priority over health matters. And so where does partnership come in to ensure that some of these critical areas are also not left behind? So yes, the child is fed, but are they learning? And so how do we make sure that that can continue even within the organizations that are around, not just Korogosho, but even around the world?
Partnership remains to be a very crucial component within an organization. And it starts at that lowest level of where you're working. And the rapport that you create with the people is what helps build a very strong foundation for a bigger and a better partnership. So that by the time you leave, the donors leave, you can find a way on how to maneuver. From the beneficiaries' point of view, you also need to bring in or plug in the government, because there are other services you don't need to pay, because the government provide them for free. And if you don't work with the government, I usually tell people there are two types of civil society. There are diplomatic civil society that will sit down with the government and tell them, excuse me, there is this and this and this you guys are doing is good, but if you can improve on this and this and this, the service delivery will be good. But there is another category of civil society that unless you protest, you will not be heard. But that is the government. You have to use both approaches. So partnership with government also remains to be key. Then partnership at the international level, the short-term partnership that maybe might yield or produce long-term partnership. So you need it from that lowest level to the highest level, but you have to be creative and think, if I'm doing issues of substance use disorder, prevention among the young people, how can I explore and bring in the aspect of education, the aspect of health, the aspect of, SRHR, and so on and so forth. So it's all about creativity and being able to see what works and what doesn't work. Being practical at times is usually easy. At times I prefer, if we are to do project X, why don't we do a mock of it? Look at the ground, get the views of the people, and gauge, does it make sense or it doesn't make sense? So partnership remains to be crucial. It runs all the way. There are others who might not be able to give you money, but you're partners with them. And if you keep on pushing out of the network that they have, they might be able to help you get some money.
That's very interesting. And we are talking about the African landscape. For the longest time, the narrative has always been Africa is just a place where we are receiving, everything is being dumped. As we are closing, I'm looking at the African landscape. We can sustain ourselves. When you look at DRC, is the richest country when it comes to minerals by far. It means if we can come together, we really can eradicate a lot of the problems that make us or force us to rely on donor funding. What's your take on how Africa can really change this narrative around over-reliance on donor funding so that we can be self-sufficient? self-sustaining?
Being self-sustaining starts at the individual level, because change cannot come if you want to bring the change with the bigger world. It must start from somewhere. I remember Mother Teresa said, if you want to eradicate hunger, you cannot feed the whole community. Just start by feeding one. And that one person should be yourself or your immediate person, because you cannot serve someone if you, first of all, you don't have even the energy to go and serve that person. So the mentality of poverty must be cleared by ourselves as Africa. And I believe one of the prominent religious person from the Catholic Church said that Africa can only be saved by Africa using African resources to bring a change in Africa.
Even as we wind up, you are not the only one who received this bad news of the USAID funding cuts, and it was quite drastic, unfortunately. What would you tell a founder who's currently trying to navigate this challenge, and what could they put in place going forward as they navigate this? Because they're panicking.
I usually say in our local context, to put on shock absorbers. And shock absorbers applies anywhere in life, be it in terms of relationship, business, work, and so on and so forth. Be ready for anything that comes. And if you are ready, you should have mechanisms of how to maneuver through. What other leaders need to think outside when such a scenario happens is, one, you need to sit down and rethink within your parameters. Come up with a matrix whereby if I do this, this one costs a lot. This one doesn't cost. So come up with a matrix whereby this is the essential, this is non-essential. Because the way things are moving, donors are also changing the way they are working with the non-profits. So if we don't put our house in order, I think we'll still be caught in shocks. So panicking is not a solution. Putting your house in order is important. Review your budget. Look at what is important and what is not important. And then again, I would really encourage local partnership plays an important role in ensuring that you are able to overcome these challenges.
Amazing. Thank you so much, George, for sharing your insights into this. You've really given us a scope of what really the direct impact was to an organization that is working not just in Kenya and outside Kenya. And so for us, really, what I'm getting from you, even as we are winding up, is that non-profits, CBOs, need to have a plan where, one, you have a shock absorber. You need to think outside the box. We are looking at revenue generation. Let's not over-rely on one source of, funding as we continue to do this important work to our society. So thank you very much for that. And that has been our episode today. We have been talking about the funding cuts and how to navigate them. We've gotten, a real account from a beneficiary who has had to rethink their strategy around this. So listen to the next episode as we talk about, the tools that you can use even as you're rethinking your strategy around fundraising.